Now your respiratory's got a little red on top of it. Since it appears that you need a reminder based on your answer with the sickle cell patient, we probably better write down respiratory distress. On the front page of your respiratory packet, you're going to write down all the things that tell us, there it is, all the things that tell us you have a respiratory distress. Everybody got the rat out? Let's hit it. Respiratory distress is what? Pulse ox less than 90. PaO2 less than 60. Grunting, flaring, and retracting. Tachy. And what's the tachy stand for? Tachycardia and tachypnea. And I'll show you guys how to really nail it here in a minute. And shortness of breath and dyspnea. Woo! Sounds a lot better when you dance, but that's okay. We're moving. Okay, now, seriously, the most important ones of all in the list. There is no person on earth doing any of this that is not respiratory distress. When you see that, you see them first, and your first nursing action is oxygen, which is why the sickle cell took a little turn. Okay. 1, 2, 3, 4, 5. This goes all together, grunting, flaring, and retracting. This you will need, and you have told me, 1600, that you thank God I taught it to you because it's on all of your freaking peds and OB tests. So you'll need that for 2300. Grunting, flaring, retracting is babies. Retracting is anybody. Asthma patients retract. Okay. Now, so anyway, boom, respiratory distress. See them first, give them O2, keep it moving. Next on the list, O2 delivery. If I have this, what kind of mask am I using? Excellent. A non-rebreather. What is my oxygen turned up to? 10 to 15 liters. Excellent. Non-rebreather, turn it up to 10 to 15 liters with any respiratory distress patient. Okay. Pneumonia. Give me some signs and symptoms of pneumonia. Fever is good. High fever. There's a pneumonia handout in there. It's already got all this written down. Crackles is excellent. Yellow-green sputum. And the classic in your pneumonia, which is in the packet, your classic, but I would write it on regular notes and look at it later. Your classic is actually a painful cough. There it is. With a high fever. Don't turn. That's it, pneumonia. A painful cough with a high-grade fever. Oh, painful productive cough, right? Because you said it best. You said green or yellow sputum. And we're going to probably end up, well, no, we will end up with chest x-rays, and they will show infiltrates. But before we can treat the patient, what do you have to do first? Sputum culture. Diagnosis of pneumonia, and listen, diagnosis of pneumonia and TB is a sputum culture. Don't let me hear you got x-ray as confirmation for TB. A sputum culture is diagnostic for TB and pneumonia. Now, we don't wait on both of them to come back before we treat. but we still do it before we treat. We have to get a sputum culture on both those patients before we give them any antibiotic. Okay, TB, as you know, there's a lot of medications. And you may or may not remember them all. I'm going to put them here. INH, rifampin for active TB. What I'm doing right now is active TB. Ethambutol, and I think it's like the last page in the packet. I don't know what that's about. Oh, I don't know. Don't ask. It looks like this. These meds that I'm writing are back there in your packet. Ethambutol and PZA, pyrazinamide. Now, I would, on that page, if you didn't do it already because you've been with me already, I swear to God, I will highlight those. Because that page is perfect. Yep. Highlight those meds. That page is the bomb on every test you'll ever take. Whether you're a nurse practitioner, a doctor, or anybody else. Everybody has this page. And everything you got to know about each drug is by it. Here's a summary of the drugs. Here's a summary of everything you probably should know. No alcohol during treatment. You need liver function tests before we start treatment. Generally speaking, you need to take them on an empty stomach. They can cause, INH can cause decreased absorption of B6. And I don't know if your teachers are going to be mean or not, but you might have to know the other name for B6, which is pyridoxine. So since INH decreases your absorption of vitamin B6, you got to take the vitamin B6 supply.